Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, those tuning in to our friends at iHeartRadio as well as Amazon Music Podcasts. We're glad you all could be with us as well. Well, one of the things we've been talking about a lot is the importance of early detection when it comes to cancer. And to date, breast cancer is the most common cancer diagnosed in women worldwide. And this year alone, an estimated 284,000 people will be diagnosed with breast cancer just in the United States alone. Well, as we know, of course, as we talk about early detection, one of the things that we can be able to see is the importance of reducing the risk of cancer returning for early breast cancer. And one of the things that also has come up recently in a study is that there is some progress that is being made. The latest findings is a type of early breast cancer were recently presented by the American Society of Clinical Oncology at their 2021 virtual scientific program. Here to talk to us about that, we're excited to welcome Dr. Charles Geyer to a program to talk to us not only about the importance of early detection, but also about the advancements that are being made. Dr. Geyer, thank you so much for the time. Really appreciate it.
Oh, thank you for the invitation.
So, as I mentioned, at this recent event, there was new information that has come to light. What are some of the remaining gaps, though, Dr. Geyer, when it comes to people with early breast cancer?
We emphasize early detection for breast cancer because we know that the smaller the tumor, the less involved the lymph nodes are, the greater the chances for ultimate success with therapy. When breast cancer is discovered, it's got to be treated more and more. We do multidisciplinary treatments with surgery, sometimes radiation, drug therapy. So it's a disease taken care of by multidisciplinary teams. And fortunately, over the years, through advances, we have progressively lowered the risk of recurrence after you complete your standard treatments, whatever they might be. However, we still are not at a point where we can tell a woman that there is no chance of recurrence. And we've known that patients who develop faster-growing cancers are diagnosed with larger cancers in their lymph nodes, different things, or what we call higher-risk patients. And by that, we just mean that with standard therapies, they may be cured, but there will be this persisting, 25, 35% chance of recurrence that has still been there as a unmet need that we've needed to work on. So what I do is work with other cancer specialists around the world to study promising new treatments that look like we could maybe add to our standard therapies that might chop that persisting 25, 35% recurrence rate down a good bit, so thereby, in a sense, curing more women who develop the breast cancer. And that's what this report that we shared at our society meeting a few months ago was about. It conducted a large phase 3 study looking at a specific drug in a certain type of breast cancer, and the results were very, very encouraging.
Dr. Geyer, I've been hearing more about the BRCA gene recently because I've seen it being featured in television shows, so there is definitely more awareness being brought, I think, to the public because of it. With that being in mind, though, I mean, when you talk about what was released at this meeting, how significant are these findings, and what might it mean for people with early breast cancer who may have a BRCA mutation?
Yeah, the BRCA mutation basically is a description for one of the genes that you get from mom or dad makes a protein that doesn't work. And the BRCA protein's job is to help guard the integrity of our DNA, our genome, as our cells divide. So we've learned that patients who are born with this copy of this gene that doesn't work develop breast cancers at a much earlier age, sometimes in their 20s, 30s, 40s, very early age, bilateral, higher risk. So there's this is, and that's an important subset of patients. It's only about 5% of breast cancers that develop are related to this gene, but it causes the disease in this young, otherwise healthy population. So it's a particularly important group. The interesting thing is the very thing that causes them to develop the cancer makes those cancers vulnerable to treatment with the drug that we used in our Olympia trial. We know in patients with metastatic cancer and BRCA mutations that these drugs called PARP inhibitors are actually more effective than chemotherapy, have fewer side effects, so they've been in advance in helping control metastatic disease. And there are actually 2 of them are approved by the FDA for that purpose. Our trial basically took the next logical step and said, okay, if we know that patients still have this 25 to 35% risk of recurrence after standard therapy, let's approach patients in that situation and see if they'll work with us on a trial where half will get the drug, half will get a placebo, and we will follow them and see, does the group getting the active drug do better? And basically what our study showed is, oh, yeah, they do substantially better. The risk of recurrence at 3 years was reduced by 42%, very, very substantial effect. And it was well tolerated, as we expected from our metastatic study. So this is a very exciting result that was featured in the ASCO. It was sort of given the status of the number 1 abstract for the entire meeting. It was published simultaneously in the New England Journal of Medicine. So it's a very, very, I think, important result for this subset of patients who have had this need. This same need exists in patients who don't have the mutation, but we have to find other things for them. This is really good news for this group that has always kind of had this extra burden of the disease coming on earlier in life and being bilateral, other cancers and things. So it's been very, very gratifying.
Really good information, and I know our audience is glad to be able to know that. Dr. Geyer, let me ask you, where can our audience go to learn more about this and the findings?
Well, it's all we always encourage. Obviously, any patient who has developed breast cancer, have breast problems, they need to see their physician, see a breast cancer specialist, and get information from them. If you're just looking for information in general, probably the single best website is the one from the National Cancer Institute that has information for patients that's been vetted, it's consensus, so it's a good source for people.
All right. Again, everyone, Dr. Charles Geyer has been our guest. Dr. Geyer, really appreciate you sharing this information from the meeting with us, and appreciate your stopping by the program. Looking forward to speaking with you again.
Thank you so much. Have a good day.
Glad to have you. You as well, and we thank your audience for tuning in to another great segment of Conversations Live. And until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live, and let's go make today amazing. Take care.